Greenish sputum is obtained in option A pneumonia, option B pseudomonas infection, option C gangrene, option D coal dust inhalation. And the answer is option B pseudomonas infection. True statement about exudates. Option A, exudates accumulate in serous cavities as a result of inflammatory process. Option B, clear or cloudy appearance. Option C, specific gravity above 1.018. Option D, all of the above. And the answer is all of the above. CSF is obtained by puncturing the subarachnoid space in the interspace between option A, third and fourth lumbar vertebrae, option B, fourth and fifth lumbar vertebrae, option C, fourth and fifth cervical vertebrae, and option D, third and fourth cervical vertebrae. And the answer is option B, fourth and fifth lumbar vertebrae. Kuchen-Steditz test is used for option A, CSF globulin, option B, CSF pressure, option C, urine specific gravity, option D, urine cast. And the answer is option B, CSF pressure. Bloody tap differs from xanthochromia in presence of option A, hemoglobin, option B, bilirubin, option C, intact RBC, and option D, all of the above. And the answer is option C, intact RBC. Cobweb-like clot is seen in CSF in case of option A, viral meningitis, option B, fungal meningitis, option C, both A and B, option D, tubercular meningitis. And the answer is option D, tubercular meningitis. CSF electrophoresis is important in option A, neurosyphilis, option B, multiple sclerosis, option C, bacterial meningitis, option D, lesions of choroid plexus. Answer is option B, multiple sclerosis. Synovial fluid contains option A, citric acid, option B, ascorbic acid, option C, high hyaluronic acid, option D, deoxyribonucleic acid. And the answer is option C, high hyaluronic acid. Synovial fluid is collected by option A, arthrocentesis, option B, thoracentesis, option C, amniocentesis, option D, paracentesis. And the answer is option A, arthrocentesis. Which of the following tests is used to test the viscosity of synovial fluid? Option A, string test, option B, mucin clot test, option C, dye test, option D, both A and B. And the answer is both A and B. That is both string test and mucin clot test. Revitalization test is done on option A, synovial fluid, option B, semen, option C, CSF, option D, sputum. And the answer is option B, semen. Franklin-Duke test is done on option A, synovial fluid, option B, semen, option C, CSF, option D, sputum. And the answer is option B, semen. pH of amniotic fluid. Option A, 7.8, option B, 7.4, option C, 7.04, option D, 8.04. And the answer is option C, 7.04. Presence of dash in CSF is an indicative of choriocarcinoma metastatic to CNS. Option A, HCG, option B, AFP, option C, aldosterone, option D, progesterone. And the answer is option A, HCG. Steatorrhea is related to option A, liver function test, option B, gastric function test, option C, renal function test, and option D, pancreatic function test. And the answer is option D, pancreatic function test. Which of the following is the test done to detect occult blood in stool? Option A, gum guaiacum test. Option B, benzidine test. Option C, aminophenazone test. Option D, all of the above. And the answer is option D, all of the above. That is gum guaiacum test, benzidine test, and also aminophenazone test. Black colored stool due to the presence of occult blood. Option A, steatoma. Option B, melanoma. Option C, melena. Option D, none of the above. And the answer is option C, melena.